May is Stroke Awareness Month, so this morning we're talking about the medical phenomenon that claims so many lives, often without warning. But the thing is, there often is a warning. People just don't know what to look for. Dr. Gabriel Vidal is a neurologist at Oxford Hospital, and he's here with Sarah Abruzli, who is a stroke survivor, to explain the key signs of a stroke, plus ways to adjust your diet to avoid having one over time. And before we get to you, Dr. Vidal, I want to talk to you, Sarah. You used to be on Our Generation when you were a teenager.
Back in the 90s.
Back in the 90s, you were young, physically fit. Sometimes people think that stroke is only for older people. What happened to you?
I went to sleep on Thursday, September 6th of 2007. A 29-year-old pescatarian, world-traveling dancer.
You mean pescatarian, eating
fish?
Fish
eating vegetarian. Dancing and working out every day with yoga and Pilates for at least an hour and a half each day. I awakened on the morning of September 7th, 07, at 4 a.m., a half-paralyzed stroke survivor. It turns out, unbeknownst to me, I was born with a congenital malformation of blood vessels. It's quite rare, called a cavernous hemangioma. In the middle of the evening, just after a ballet rehearsal, this little tumor burst in my brain. It was located precisely on the motor strip on the right side of my brain. Therefore, my only affect was losing the ability to move on the entire left side of my body. So I had to relearn to walk, to use my arm, but in a way it's a blessing that my only problems have been motor. I didn't have any cognitive troubles or problems with my speech or problems that would stop me from having a baby who turns 4 months old today, my beautiful son, Alexei.
And life goes on. And I want to talk to you because Sarah is one of 7 million people living, stroke survivors in this country. While her condition is congenital, what are the major causes of stroke?
Well, Sarah, the important thing to know here is what things make you more prone to having strokes, what puts you at risk. And, you know, high blood pressure, having high blood sugars, high cholesterol, smoking, drinking in excess, drugs, and not keeping a healthy lifestyle are the things that will precisely make you more prone to having more strokes. So knowing which of those things you have and how to address them is what's going to keep you, or make you less likely to have a stroke in the future.
So it's so important, though, to know the first signs that you are having a stroke so you can get medical attention immediately. And FAST is something for people to remember. And tell us what that means.
Well, FAST, it stands for face, arm, speech, and time. And those are the things that if you identify anybody with any of those symptoms, meaning slurred speech, face droop, or inability to talk,
inability to raise both arms over the head.
One side, actually, it'll be mostly one arm at a time. Strokes usually will affect one side of the brain.
Just going over it very quickly because I want people to know this. Face drooping, arm weakness, inability to speak clearly, that is the time to call 911.
Yeah, it's important to show up as soon as possible, because the sooner you get to the emergency room, the better chances you give your physicians to reverse the effects of the stroke. Every second that goes by, more brain cells will die. So the longer you wait, the more brain dies. And once the tissue is dead, we really can't do much for it.
And fruit and vegetables, it's very important to have that in your diet?
Well, certainly, they will help you maintain, be healthy and stay fit. But avoiding things like a lot of fried foods, a lot of red meats, fast foods, and those things like that, they really won't guide you towards the right steps.
All right. Well, Sarah, I want to give you the last word. What do you want people to know about stroke and the importance of prevention?
If one is afflicted with a stroke, it's so important to stay motivated in recovery. And I recommend not trying to recreate perhaps the old life that one had before the stroke, but look toward what you can give in the future and where your talents can shine. My talents used to be as a ballet dancer. I've chosen instead to be an actor and a mama now.
Oh, and you're an actor.
Please never give up, never lose motivation. Even 6.5 years after my stroke, I continue to recover. And that's through my own strong determination to survive and thrive.
Well, you are a role model. Thank you.